if like what's up you guys, Aditi, welcome back to our channel. We are back with another therapy video. I know we spoke about therapies in the last video as well on Friday, but I just thought I'll make another one because I really like this topic. Okay, so we've already seen psychotherapy and insight therapies, which was in one video a few weeks ago. Then last week we saw cognitive therapies, behavioral therapies, and CBT, cognitive behavioral therapies. Today we are going to look at biomedical therapies. So biomedical therapies are nothing like talking therapy. If I have to explain it in short, I would say it's about prescribing medications. So a little heads up that psychologists do not prescribe medications, only psychiatrists prescribe medications. So counseling psychologists do not see patients, they see clients. So what I mean by patients and clients is they're not patients because they do not have a mental disorder, a psychological disorder, a mental illness, which the kind of people that clinical psychologists see alongside with psychiatrists. So such people, somebody who has bipolar or maybe schizophrenia, there could be psychiatrists who does provide therapy and prescribe medications, or they only prescribe medications and then this person also goes to a clinical psychologist for therapy. So basically to learn to cope with the symptoms and learn more about themselves and the problems and issues that they may have because of this psychological disorder. Biomedical therapy strategies rely on direct physiological intervention, that is to treat the symptoms of psychological disorders. So I just said how psychiatrists provide medications and clinical psychologists provide therapy. So that's the point I'm coming to, that normally both of these, like basically biomedical therapies aren't just used alone when it comes to psychological disorders. It's always used with another kind of therapy, maybe mostly psychotherapy. If somebody has very less severe symptoms of a disorder, then that could be dealt with just medication, but it's mostly it's mostly combined with maybe insight therapy or maybe CBT. So there are three different major classes of biomedical therapies. So first is that the example that I gave you about medications. So there are three kinds of medications. So first is anti-anxiety drugs. So basically that the name explains it, that it helps alleviate the anxiety that a person may have. But one needs to understand that it does not cure anxiety, it could help with the symptoms of anxiety. Another thing to remember as somebody who is going to prescribe medications, or even if you are a patient, it's very important to be honest with your doctor or with a therapist for this reason, that when a person is on anti-anxiety drugs or is taking anti-anxiety medications, they are not supposed to consume alcohol or any substances that kind of are central nervous system depressants, so maybe marijuana or LSD or something like that. The reason is that there is this neurotransmitter. Neurotransmitters are chemical substances or messengers that are transmitted in neural impulses. They are the things that actually help us feel vagara vagara. I'm not going to explain much. There is a video on neurotransmitters, you can go and check it out. So one of the neurotransmitter is GABA, which is gamma aminobutyric acid, if I'm not wrong. That actually helps us feel relaxed and it kind of alleviates anxiety. So anti-anxiety medications act as an agonist to GABA. Agonist is something that will increase the functioning of the neurotransmitters. So there are two kinds of neurotransmitters. Oh my god, I'm going to explain the whole video again. Anti-anxiety medications actually increase the functioning of GABA, and that's exactly what even alcohol does, because even alcohol is like a depressant. It kind of relieves anxiety as well. So does the other central nervous system depressants, and that's the reason why two things together can be really bad, like really bad, like fatal. So it's very lethal and it's very fatal, so don't do that. Somebody who is taking anti-anxiety medication, they do need to remember that, I'm just repeating this again, that it does not cure GAD, generalized anxiety disorder, or any other kind of anxiety disorders. You can check the two videos out. It just helps you with the symptoms, but you have to go to therapy and you have to learn to cope with different life situations that come your way. There are going to be different situations in our life that make us feel anxious. It's a very normal thing. It is helping us survive. It has helped our ancestors survive, and it is doing the same thing even in the 21st century. So things are going to happen in our life, and we just need to learn to cope with it. So medications are going to help you up to a certain point, but after that you have to help yourself. So you definitely have to go to therapy. Medications are not the only answer. The second type of medications are antidepressants. So obviously they are used to treat depression and to elevate mood. It helps relieve many typical symptoms of depression, such as sleepless or excessive sleepiness, chronic fatigue, loss of appetite, sadness, and feelings of worthlessness. Again, it does not cure depression. Just like anti-anxiety medications, antidepressants do not cure depression. It only helps you in relieving the symptoms that you may have. There are side effects as well. So there's weight gain, anxiety, insomnia, decreased sex drive. Also, another disclaimer that all of these side effects may not apply to you. Everybody reacts differently, or rather, every medication reacts differently with people. So some may gain weight, but the other person may not. So it depends on, it's very subjective. Again, another thing that is very important is that people expect very quick results with medications. That does not happen. I have spoken to a friend of mine who is a psychiatrist, and in my textbook says this, that it takes at least 2 to 4 weeks minimum for antidepressants to actually work and for us to see some changes. And it can take a long time for some people who have severe symptoms of depression. The third and the last one are antipsychotic drugs. They help to relieve symptoms of psychoses, such as extreme agitation, hyperactivity, hallucinations, delusions. One disorder I can think of, and I think everybody's thinking of right now, is schizophrenia. So people who have schizophrenia, they are prescribed with antipsychotic drugs. One thing to remember with antipsychotic drugs is that it helps with the positive symptoms, but it does not cure the negative symptoms. Now, in schizophrenia, there are positive symptoms and negative symptoms. Positive does not mean it's a good thing. Positive means it is adding something to you or to your behavior which should not exist, something like maybe hallucinations or delusions. And negative symptoms is it's taking something away which should be there, like humans are a very social animal, so it's taking that social aspect of humans away. And people who have schizophrenia sometimes tend to be catatonic, or like socially exclude themselves and not interact with a lot of people. There are some side effects again. So one is apathy. It may produce apathy, as well as it reduces the patient to a zombie-like state. A small portion of people may even develop tardive dyskinesia, which is characterized by jerking movements around the neck and face and involuntary protrusions of tongue. Good news, the newer medications have fewer side effects. So I said there were 3 classes to biomedical therapies. So that first was psychotropic drugs. Second is electroconvulsion therapy, or ECT. So ECT involves administration of an electric current to the patient's brain to produce a convulsion. It helps to relieve severe depression in some patients to reasons not completely understood. ECT involves 6 to 8 treatments, which is spaced over a period of several weeks. It is administered to the temple area for a fraction of a second. Within half hour, the patient awakens and remembers nothing of the treatment. Most common side effect is memory loss, which is like that happens a little before the ECT. So that's known as retrograde amnesia. Third and the last one is psychosurgery, which is like the last resort. So psychosurgery is designed to destroy or disconnect brain tissue in an attempt to regulate abnormal behavior. So prefrontal lobotomy is an example of psychosurgery. So in this, surgeons sever nerves connecting the frontal lobes of the brain with emotion controlling centers. Although many severely disturbed patients become calm, others emerged from surgery can result in vegetative state. So the best example is of HM. He suffered from seizures, and that kind of impaired his normal functioning. Like imagine, like it's very embarrassing. Like if you are in a mall or if you are standing in line and you just start getting seizures and everybody just is around you, and that's exactly what even happens with people who have panic disorders. And that's the reason why they start having agoraphobia as well, and that is like difficulty leaving the house, being afraid of leaving the house, because you're so fear stricken that you're really scared to even leave the house because of what if I have a panic attack, or what if I get a seizure in the middle of the street. So it was literally impairing his day-to-day functioning, and that's the reason why he got ready to get a surgery done, psychosurgery, where the surgeons actually removed his hippocampus. We know what hippocampus does. It's a part of the limbic system, and it is actually that part of the brain that actually consolidates our short-term memory into long-term memories. So can you imagine what's going to happen when his hippocampus is removed? Definitely the seizure stopped, but he could not form new memories, which is known as anterograde amnesia. So he would remember anything that is happening in the present. Like if somebody enters the room, he would ask them what's their name, they would have a nice conversation. The second the person left and re-entered the room 2 minutes later or a minute later, he would not remember who that person is. But he was relieved from the seizures at least. Psychosurgery is like the last resort. Then there is ECT, which is again kind of like a last resort, and then we have our psychotropic drugs, which is used quite regularly in today's times. And that is it for today's video. I think this video is quite short, and that's what I like about it. Like, share, subscribe. Let me know if you're liking these therapies videos. What else do you want to see on this channel? And I'll see you next Friday with another psychology video.